Welcome to the Metabolic MD. Health means everything. We all seek optimal health, but most of us do not know how to achieve it. Dr. Kolodzik has spent a career in the emergency department. Now, he helps his patients avoid ever ending up there. During these podcasts, you'll learn how you can lose weight and prevent and reverse disease through new technology, a modified diet, and the use of some new recently approved FDA medications. This information is not meant to be medical advice. Please seek consultation from your own medical provider. Let's listen in.
We want to thank our following sponsors, themetabolicmds.com, a boutique weight loss practice focusing on weight loss through modern technology, the latest GLP-1 weight loss medications, and health coaching. We also want to thank the CGM Doctor, where you can purchase a CGM without a prescription delivered right to your door and also find useful information to get the most from your CGM to improve your health and weight.
Dr. Paul, welcome back.
Glad to be here again, Terry.
I haven't seen you in a couple of weeks, and it's, you look good.
Oh, thank you. You look good too, Terry.
Well, of course, that's not doesn't need to be stated. Danielle is here with us today. Danielle,
Hello.
You do look good.
Thank you. Thank you so much.
You're getting ready to fly off to a new journey in South Carolina, actually Georgia.
It's Georgia.
And
Yeah.
what college are you going to go to for a master's degree?
I'm going to be heading to SCAD.
SCAD.
Yeah.
All right. Well,
You got to tell us what SCAD stands for.
Yeah, I was going to say.
SCAD stands for Savannah College of Art and Design.
We'll see.
Great.
We're learning something here.
Yeah.
Yeah, congratulations on that.
Thank you. Yeah.
And
it'll
we're
be
gonna
a
miss you.
New journey for sure.
But you're going to drive back for every podcast that we do, correct?
Every podcast. Yeah. I'll be back.
All right.
Danielle's going to continue to work with us remotely, so
Yes, I will.
We'll have the opportunity to continue to work together.
So today we're going to be talking about a few different things. We call it the potpourri of medical knowledge with Dr. Paul. I can't think of a better name. But before we do that, I am going to become your client. You didn't know this, but I'm going to be buying CGMs from you.
That is you're okay. That's okay.
Yeah.
All right.
Through the CGM doctor.com.
So yeah, tell us why you're going to do that, Terry.
So real quick, I switched over to Medicare and ARP, United Healthcare, and I don't know why. They just can't fill my prescription. It's like struggle. I call 1,000 times. Oh, we're waiting on this form. So I'm just going to, and it's cheaper. It's cheaper to come to you to get them.
So you went on to Medicare.
I did.
And because you're the young age of 65.
Correct.
And you basically, your CGMs became more expensive through your insurance than they are over the counter.
Oh, absolutely. The only difference between the ones they give me, which are the Freestyle 3s, that gives you alarm for low blood sugar, versus ones that you sell.
Yeah,
They say,
which don't have alarms. Yeah.
They don't. But I had one in each arm.
So not recommended for diabetics, by the way.
But I'm going to use it anyway.
This your call, Terry.
I mean, it works great.
Yeah, they do work great. So
I'm saving money. And I think it's a better product.
Yeah. So yeah, I mean, I think people are finding that sometimes working through the intricacies of insurance is difficult, and just going the over-the-counter route sometimes is better.
Yeah,
and it's really nice because you have a subscription program too. So you can make the purchase one time and then your card is automatically charged every month. And 2 CGMs show up at your door every month.
I'm just wondering, is he going to deliver them in person?
Sure, Terry, I'll be happy to do that with a smile on my face. Are you going to tip me?
I'll give you a tip when you drop them off at the door.
So actually, I got to clarify. The over the counters don't have alarms. Not supposed to be used in diabetics. So I got to make that disclaimer.
Make that disclaimer. But guess what? I'm a diabetic and I'm going to use it.
Yeah.
That's personal choice, isn't it?
It is personal choice.
There you go.
You know, the risk there is if somebody's on insulin. You know, less risk if you aren't on insulin, but if you're on insulin, there's a chance you could have a hypoglycemic episode. Alarm wouldn't go off, so you got all those issues.
I got those issues, and my wife wants me to funnel through and push for the ones with the alarms because it gives her an idea that I'm going low. But
yeah,
I just can't do it. The insurance thing's killing me.
Okay.
All right. Well, long story.
Personal decision. This is America, Terry. You can do what you want, right?
Land of the free. All right. So today we're talking about multiple topics on this short podcast with Danielle. Yeah. You represent a whole generation of youth, Danielle.
I am youth.
You are youth. We are old. What's the first topic?
So I get this question a lot, and I saw an article on my newsfeed related to this, and it was just really like, okay, what's really the difference between prediabetes and diabetes? So, I think those terms get confused sometimes by people. People have a tendency not to worry about being pre-diabetic when I think they should worry about it a lot more. But let's talk about what the hard numbers are first.
Go ahead.
Okay. So usually you are considered to not have prediabetes if your morning blood sugar is under 100. Okay, so if you have a CGM on, you get a blood sugar every morning, and you can see if it's over or under 100.
Right.
And so a blood sugar over 100, between 100 and 125 is considered prediabetes. And then if you're over 125, that's considered diabetes.
And we call that a fasting number. Are we?
Yeah, fasting number. Both those numbers should be not having eaten for probably 10-ish hours or so.
But people, somebody didn't turn their phone off. Wonder who that would be.
And it's not the young person in the room.
And it's not the producer.
This new technology throws me off.
I have a question for you. How long should I be wearing that CGM to get an accurate read of that average morning number?
Well, I mean, the CGMs last for 2 weeks. So what I recommend, they come in packages of 2. What I recommend to people is, get one and don't change your diet for 2 weeks and just see where you kind of live. And then you can use the second one to guide your diet. And then after that, going forward, you can continue to use them kind of as needed intermittently, depending upon what your numbers are. Now, if you have bad numbers, you might want to be wearing one continuously until you get your diet all set.
So for those first 2 weeks wearing the CGM, if my morning numbers is above that 100, then I should be paying attention to the fact that I might be
Yeah, there's some nuances to that. There are some other things that can change it, but in general, that's the number. So like if you go to your doctor once a year or twice a year, get lab work, that's what they're focusing on, is your blood sugar over 100. Now, I will tell you, I've got lots of patients based on, the fasting insulin levels we do, which most docs don't do, where, they can have blood sugars in the 90s, have some insulin resistance, and that's an early heads up that you're heading to prediabetes. And then the other variable is the, well-known hemoglobin A1C numbers.
Right.
And A1Cs measure where your blood sugar has been over the course of the last 90 days because it's the amount of blood glucose attached to your red blood cells, and red blood cells live in your system for 90 days. So that hemoglobin A1C number is 5.7. If you're less than that, you're considered not to be pre-diabetic. But if you're between 5.7 and 6.8, you're considered to be diabetic.
Yeah.
So this is all kind of a continuum based on the amount of insulin resistance you have, and that's why I always calculate the level of insulin resistance in every one of my patients.
What's funny is, and maybe it's not funny, but when somebody hears I'm pre-diabetic and they don't take it serious, right, and they just let it go into, like me, and I never knew I was pre-diabetic. I was just, hey, you're diabetic. There wasn't a pre for me back in the day when I found out. But somebody said, you're precancerous, right? And you could say, well, shit, what do I got to do to fix that?
Yeah.
Right?
Yeah,
they would do it.
It's a good analogy. That's a good analogy, Terry, because, the terms I've used is if you're pre-diabetic, lights and sirens should be going off, flashing, because you can reverse that pre-diabetes and never become diabetic. But if you cross that line from pre-diabetes to diabetes, it's really irreversible. Now, I've had a lot of patients that diabetic patients I've worked with, we've been able to get off them medicines, but you're really going to have that significant insulin resistance lurking in the background as you get older. So for people out there, if you're pre-diabetic, and then pay attention to that. It's a big deal. Do something about it. Well, you can do something about it. The problem is, and one of the reasons my practice exists, is American medicine de-emphasizes that. I mean, the pattern often is, because the primary care docs are so busy in their offices, is, you're pre-diabetic. We'll keep an eye on those numbers. We'll check it next time, rather than the dietary intervention and the fasting and the other exercise regimens that can help you completely reverse your prediabetes.
And it's not limited to age, right? I mean, it's not like, 50 and over, you're pre-diabetic. Because
It's
one of my
usually
friends,
limits the weight, and then it's kind of
Well-
if you're overweight, odds are high that you're going to be pre-diabetic.
You're likely to have more insulin resistance, but I have had overweight people that really don't have any blood sugar problem. But the typical American, 60% of adults being overweight, there's a high number of people that are pre-diabetic and don't know it. In fact, the suggestion is 30% of people in the U.S. are pre-diabetic, and half the people that are pre-diabetic don't know they're pre-diabetic.
Right. All right, so let's move on to topic number 2. That's a good conversation. Did you hit all the things you wanted to hit on that one?
Yeah, we're good.
Okay, what's topic number 2?
Well, Danielle had a topic I think we were going to talk about, because this is something I think she has better knowledge based
What,
on
the
than we
latest
do.
dance craze? What's your topic, Danielle?
latest dance.
I don't know. Latest TikTok dance craze?
No, so being, in the younger population and
Rub
being
that
part
in.
of Gen Z, I am a Gen Zer, and a lot of my friends are millennials or younger millennials, and so there's this whole thing called the sober curious movement going on, in which a lot of young people who've never drank alcohol, or maybe they used to drink alcohol and now they're all going to these non-alcoholic drinks. I would be curious to know how that actually is affecting overall long-term health for people, because there isn't alcohol in it.
So what has spurred this movement? Why are people choosing not to drink? Is it just a health concern, or?
A lot of it's a health concern about alcohol has a lot of negative effects. Obviously, it's very addictive, and it can cause a lot of long-term issues with, dementia and all these other things.
Yeah, absolutely.
So that's a big piece of it. A lot of young people are like health conscious, and they crave the trends, if you will, and it's kind of a trend right now, especially in some of the larger cities. They go out to these bars, they go to coffee shops, they go to restaurants, and they don't want to drink alcohol, but they still want to hang out with their friends and act cool or whatever. And so they get the non-alcoholic drink that still looks cute and it tastes good, but it doesn't have the alcohol in it. But I feel like we're ignoring the fact that there's still a lot of sugar in these products. There's still a lot of carbs in these products. And just because it has less than 0.05% of alcohol in it, is it really a healthier option?
So I think overall, less alcohol is better. So I think that's a very positive trend. I think, limited alcohol is not necessarily deleterious, but a lot of people, go down that slippery slope where, what once was, a drink or two a week then becomes much, much more. So actually, I laud your generation.
Thank you.
For,
Don't you feel it's a little bit? It feels a little bit like a woke thing, doesn't it? Doesn't it feel like one of those, like, I'm woke, I want to use the right pronouns, let me not have a drink.
how does he turn everything into something political? How does he do that?
He really does.
It just feels awkward to me. I mean, I don't drink. I've never drank.
Yeah.
But this feels like one of those things where, I don't know.
So part of it has come from people who have developed alcoholism or developed drug addictions, and then they went sober.
Yeah.
And their friends would hang out with them, but their friends would feel uncomfortable drinking alcohol around them. So what was that option? The option was get a non-alcoholic drink.
Oh, my
that
friends
still
loved the fact
tastes-
that I didn't drink. I was the driver every friggin' time. I said, really? Hey, what are you doing tonight? I don't know. Come with us. They didn't want me to be a friend. They just wanted me to drive.
The only way
The
to-
DD. Designated DD.
Yeah, it's the only way he could hang out with people, because nobody would want to be around
Yeah.
the other guys, right?
So do you drink a little?
I drink alcohol.
Is it
Yeah.
wine typically?
No, I drink actually beer.
Really?
Yeah.
I don't picture that.
Yeah, beer. I mean, I'll drink a little bit of wine, but yeah, my go-to is like an amber or an Irish red.
And what about you?
I don't drink any hard alcohol.
Like scotch or gin?
Yeah,
or,
I'll have a glass of wine occasionally, and I'll have a beer occasionally as well.
Yeah, I never drank because I didn't know at the time, but my brother was an alcoholic, and it didn't work out too well for him. But I stayed away from it from high school on.
Yeah. So, again, in general, let me just make a comment about alcohol related to metabolic health. So if you have alcohol in your system will preferentially burn the alcohol. So the point there is that if you're burning alcohol, you aren't burning carbs during that period of time. So, you can look at, you can drink pure alcohol and you say no carbs, oh, I'm good. But the problem is you aren't burning carbs that are in your system during that time. So, and then the other thing really to be aware of related to these drinks, I think you alluded to, was you just got to be careful of the sugar content. So if you're drinking, frou-frou alcohol drinks, then, with, I don't know, you guys put umbrellas in them or, whatever. You just got to be careful because the amount of sugar in those drinks can be very, very high. So, if you're, real good about your diet, you're trying to go low carb, increase your protein, but then you got to be careful about those drinks. Where's CGM while you're having one of those drinks?
Oh, there you go.
Ooh, that would be
you could be the
super
circle back to
interesting.
plugging CGM. So.
No, that would be super interesting though, because if you don't, I'd be very curious to see what the spike would look like. An alcoholic frou-frou drink with the umbrella and the non-alcoholic of the same drink just without the alcohol. What's the difference in the spike? Even though they have the same amount of sugar, how is the alcohol affecting those two?
The dominant force there would be the amount of sugar in the drink.
Okay, wow.
This still feels like one of those trends. This is a moon rock of 2025.
At least it's a healthy-ish trend, right? At least they're not going out and saying drink more alcohol.
I guess
It's a
it's
sober
true.
movement.
It sounds great. It's a trend. It's one of these things that your younger generation people are just doing to irritate us older folks. Okay, next topic.
Speaking of trends.
Yeah.
Okay. So there is this new trend that's circling back around about the use of creatine supplements.
Oh,
Have you
For
heard about
bodybuilders?
That's super popular.
Super popular, right?
Really?
Oh,
I've never
yeah.
heard of it.
Oh, yeah.
So creatine is a substance that's naturally made in the body, made in muscles mostly, and it has to do with the energy metabolism in the muscle. And going back, quite honestly, many years, 25 or 30 years, this has been something that the bodybuilders have been using in the
Yeah,
gym.
my brother did it. Yeah.
To help supplement increase in their muscle mass. And the scientific studies say it does, in fact, help you increase your muscle mass if you use this supplement routinely. Now, one of the issues is, in addition to helping with your muscle mass, it can cause you to retain fluid. Okay, so your weight can go up from a fluid standpoint, from a water weight standpoint as well.
But isn't creatine one of those things they measure in your blood profile?
So that's creatinine.
Oh, come on, you guys.
Different substance. Yeah, creatinine has to do with, they're related, but it's a different substance. Creatinine has to do with your kidney function, a very important measure of kidney function.
Right.
And actually, there's few contraindications, meaning reasons you shouldn't take creatine, but one of them is if you have kidney issues, then you should avoid creatine. But the article I read recently talked about how this had always been under the purview of, the meatheads in the gym that are lifting weights, taking creatine. But it's becoming very popular among women to help tone and build muscle mass as well in recent years.
Both my sisters take creatine as a supplement.
Yeah.
And
Really?
they're both,
Yeah.
they're both, they're not bodybuilders per se, but they're in the gym for 2 to 3 hours
And they
a
were
day.
like college athletes, weren't they?
Oh, yeah.
Yeah.
Yep.
Yeah.
Well, my one sister's in the military. So, yeah.
Wow. So you're coming down pro creatine, it sounds like.
So, unless you have a kidney issue, it's positive. But the one negative for women is this water weight issue, And in the article I read, they suggest, the guys gain 2 pounds and they think, this is great, man, I'm gaining muscle mass. But women gain 2 pounds and they aren't necessarily happy about that, especially if it's related to retaining extra fluid and getting some bloating around their menstrual cycle times.
Is there a way to help decrease some of that water retention then, even if you're taking that supplement?
That's a great point. In the article that I read, there are a couple companies that are adding other supplements to try and decrease that. Now, I'll be honest with you, I'm not a real expert in that area, but I think people here could research as to see if it's so. So in general, if you're strength training, creatine is not a bad idea. If you're a woman, as long as you don't have kidney issues. If you're a woman, be aware of the potential water weight. And there are like this article had one company that was marketing creatine supplement called Sheatine. So,
Oh God.
so it is supposed to be specifically for a woman. But if you're spending a lot of time in the gym, whether you're a male or a female, and you're interested in this, it generally I don't think is damaging in any way, and it's been documented to help with muscle mass.
That's interesting.
Is there a specific supplement that you have heard of? We don't obviously want to promote specific supplements.
Yeah,
but
I don't really. I mean, I think in general.
It's like milkshakes, right? It's like a creatine shake.
Yeah, you can add it to your protein shakes.
Okay.
Or some people just take it straight. You can get it in pills, or you can add it to any kind of drink. So.
Would you lean on the side of organic? Is that a thing?
I don't know, to tell you the truth.
Okay.
I think creatine is creatine. I don't think it's necessarily an organic or non-organic thing.
All right. So before we land this podcast, I do want to make one mention that we are coming up on Father's Day. And if you're looking for a Father's Day gift that would be so well received, Danielle, you know what that gift would be?
Creatine?
No. Damn it. I
know what it is.
Up. What are you doing?
I know what it is. We were just talking about creatine. I was thinking about my dad, and he needs more muscle. It's fine. No.
What gift would be perfect?
You're going to get your dad creatine for his Father's Day. Is that
I'm
going to
get him creatine and Dr. Paul Kolodzik's book.
That's where I was going. See, I'm trying to plug the book for him as a Father's Day gift.
The Continuous Glucose Monitor Revolution for non-diabetics.
Yeah.
And it is the best-selling book on Amazon. You're still up there, correct?
Right. Yeah.
Yeah. So if
recent orders are coming in. We checked the data this morning.
Yeah.
People ordered not only the book, but also CGMs from the CGM Doctor website.
Yep.
And also the online health coaching that we have available.
All right. So instead of going too much further on this podcast, we're going to land this one here because we have another podcast we're going to do on episode number 2. We're going to cover more topics.
Sounds good.
We'll land this one, and you'll hear the continuation next week. Thanks.